Welcome to Balanced Health. I'm Shirley Rose and this is Joe Costello. Today's episode is the first in a two-part series on colorectal cancer. This common and sometimes deadly form of cancer has made headlines and has personally touched many families, including my own. My husband Jerry was diagnosed with colon cancer in 1985 and battled it for several months. Through much prayer and excellent treatment, he beat the cancer, and we're so thankful because, you know, not everyone does. Joining us in the studio to teach us what colorectal cancer is and what preventative and screening steps each of us should be taking is Dr. Dan O'Reilly. Dr. O'Reilly is a gastroenterologist with over 20 years of experience treating digestive disorders and colorectal cancer. In addition to his private practice, he chairs several medical committees and is respected lecturer on the topic of colorectal cancer. He's also a very special person to me and Jerry because he's Jerry's gastroenterologist and he helped us to detect and treat Jerry's cancer. So nice to have you, Dr. Dan.
Welcome to the program, Doctor.
Thank you. In fact, I say you and God and President Reagan saved Jerry's life, but we'll get into that later. Today we'll be discussing the risk and prevention of colorectal cancer, but first Joe has this week's Nutrition in the News. Joe?
Well, Shirley, you know, since I'm bathing again, I thought this would really be an appropriate topic. Most soaps that are labeled antibacterial contain triclosan. Many scientists now believe that not only is triclosan unnecessary in most ordinary cleansing cases, it could also contribute to the rise of drug-resistant bacteria. In addition, since we absorb 60% of whatever is put onto our skin, triclosan is not something you want to be putting on your skin without good reason. Now, exposure to triclosan can damage the organs and disrupt hormones. Outside of our own bodies, triclosan reacts with chlorine in tap water waste to create chloroform, a toxic chemical that eventually can wind up in waterways. Chloroform is not something that I remember in the old Dr. Quincy episodes, and they would put chloroform over somebody to make them pass out. So I'm thinking I probably don't want this in our waterways.
Well, my mother says, you know, that's how they put you out back when she was having her babies.
Yeah, that's what I mean. That's all I remember about chloroform is passing out. But we're going to talk more about soaps, surely in our later segment about buying, how to buy good soaps and what's bad soap. So we're going to touch on that again later.
I'm looking forward to it because I thought the perfume in it was the #1 consideration.
Of course you did. Of course you did.
Well, it's really a joy to have Dr. Dan with us today, and he is a very well-respected gastroenterologist, and I feel like a personal friend, right, Dr. Dan? Because you've been Jerry's doctor now for 25 years or so. But first of all, the first question is, what is colorectal cancer, and is it the same as colon cancer? Because that's what Jerry had, was colon cancer.
Right.
Can you explain the difference to us?
Well, colon cancer is really any cancer of the colon up to the point of the rectum. The rectum is the last 12 inches or so of the colon. So we tend to lump them together as one unit, colorectal cancer. And it's any malignant growth that occurs inside that organ.
Okay, and Jerry's happened to be at the upper end of the colon, as I remember.
Correct.
So that's why I guess it would just be called colon cancer. But
right.
Can we back up a little bit just so our listeners can get a picture? Can you just create a quick visual for us on what that digestive tract looks like? A lot of people don't know that the colon and the large bowel is basically the same thing. Can you kind of take us down from the stomach to the, how does that look?
Well, esophagus is the swallowing tube.
Okay.
Stomach is the reservoir that holds our food after we eat. And then you have 20 feet of small intestine. It's the part that looks like spaghetti when you see the pictures in the books.
20 feet, that's amazing.
Right. Colon is the lower intestine. That's the last 5 feet or so, and that's where the waste material is processed for final elimination. The rectum is the last stage in that whole process.
And the colon is often referred to as your large bowel as well, so do those terms used one and the same or interchangeably?
Correct. Right.
Okay.
People will often confuse the term upper intestine, lower intestine. The lower intestine or the large intestine or the colon are all the same thing.
Okay.
The upper intestine typically refers to the small intestine, which is at 20 feet.
Now, why is colon cancer so prevalent, or is it prevalent? What's the incidence of colon cancer?
As you pointed out, it's the third most common form of cancer in both men and women. It's also the third most common cause for cancer death in our country.
Third, wow.
And it's common probably for genetic reasons, environmental reasons, dietary reasons. We know that it's much more prevalent in Western developed nations than it is in less developed countries. Theories have to do with diet, the amount of grains in the diet versus the amount of processed foods or red meats. But it's certainly quite common in this country, and that's why there's such a big focus on colon cancer nowadays.
I see.
You know, I think when I think of colon cancer, I liken it to lung cancer in the sense that it is so preventable. We'll talk about some of the lifestyle things we can do later as far as, you know, exercise and the way we live. But can you touch on the prevention aspect of it as far as people coming into your office? What can you pick up on right away? And how much of this cancer do you think, I know you can't answer this scientifically, but how much do you think we can eliminate if people did what you're about to tell us they should do?
Most of it. You know, the data suggests that probably 90% of colon cancers can be eliminated or prevented.
That's amazing.
If people will follow the guidelines. And the guidelines very simply mean that you should go for a screening test on a regular basis. The most common, and we'll probably talk about this later, is colonoscopy. It's certainly the gold standard that all other screening tests are compared to. But there are other things people can do: lifestyle changes, healthy eating habits, exercise, keeping your weight down. All those things may play a part in the prevention of colon cancer.
Doctor, isn't it true that one of the reasons it's such a killer is because there are no symptoms until it's advanced? Is that true?
That's right. Unfortunately, we tend to find colon cancers when they're in the progressed stages if we wait until people have symptoms. They talk about, in the old days, we talk about the warning signs for colon cancer: change in bowel movements, blood in the stool, difficulty eliminating. By the time you have those symptoms, you've probably got an advanced process. And only those cancers that are down in the lower portion of the colon, near the rectum, will present with symptoms. Frequently, a far advanced cancer in the right side of the colon has no symptoms until it's metastasized and the patients are losing weight or having some other advanced signs of cancer.
And it usually progresses to the liver, I understand, is one of the places. Well, you know, in Jerry's case, which we mentioned, and you said you would never bring up Jerry's name, but since I did, it's okay. But, you know, he actually had no symptoms, but went in to see you, and you said, well, I'll have to give you a colonoscopy to really, you know, this is the best test, although it's invasive and it takes a day, you know, off work and whatever. And my husband, being like a typical man who doesn't ever even want to go to the doctor, said, well, okay, that's nice. And then he went home and thought about it, but put it off. And 3 months later, Ronald Reagan got colon cancer. And interestingly, it was exactly the same spot that Jerry's was. But because of that, I think it was the prompting of the Lord. You know, he said, I'm going to go have that test. And he did, and found 2 polyps, and one of which was cancerous. And then 3 months later, you know, found another one. So he had 2 surgeries. But that was 25 years ago, and praise God, he's fine today. But how would that have been handled differently today?
Yes, you know, we've kind of changed our thinking. 25 years ago, the emphasis was on disease intervention. Find a problem, figure out what's causing it, and solve it. Now, much greater emphasis being placed on disease prevention. We see that with mammography, we see it with pap smears, we see it with healthy lifestyles. And in colon cancer, it's really the mainstay of really trying to prevent the cancer before it grows. If you can go in and find a polyp in the colon and remove it, you're effectively preventing the cancer from developing in that colon. So we really have shifted our focus. When Jerry came in to see me almost 25 years ago, we really weren't talking about screening colons back then. We were talking about still doing digital rectal exams and maybe a colonoscopy if you had certain criteria: blood in the stool, anemia, things of that nature. Now we've kind of shifted over to saying anybody over 50 should have a colonoscopy at least once in their lifetime, and probably every 10 years to kind of keep tabs on the colon and intervene before they've developed an advanced neoplasm. Get a small polyp, take it out, you're not going to get a cancer there.
Well, speaking of screening, a lot of people think of a colonoscopy and they think of it as a very unpleasant experience. I've had one that actually isn't. The first couple seconds, I've not something that, you know, but outside of that, you hear about these virtual colonoscopies now because they're less invasive. People are much more willing to take them, but at least the reading that I've done, they're somewhat controversial. Can you talk about what that is and talk about false positives with these things, et cetera?
The other name is CT colonography. It's, in effect, it's a CAT scan that's done after you prep for a colonoscopy. So you go through the same clean out, the same bowel cleansing that you would do to have a colonoscopy, and then instead of having the colonoscopy, you have a CAT scan. And they use a kind of an interesting computer technology to recreate almost a 3-dimensional image of the colon. It's really like a video game of the colon. It's this virtual trip through the colon.
Is it accurate, though?
Very accurate. You get very detailed images. It is dependent on several things. One, you have to have a good clean out. If you're not well prepped, residual stool, waste material may look like a polyp, and that's what we call false positives, finding something that isn't really an abnormality. On the other hand, you can go through that and have a false negative where you don't see anything and that patient is harboring a polyp or a cancer.
Well, we have to go to break, but I'll hold that thought because I want to talk more about this test. It's very interesting, and I want to talk about how reliable it is and how should you choose which one to have.
Pick up on it.
Yeah, let's pick up on it. But for more information on today's show, visit tln.com and then click on shows and then go to Balanced Health. Or to get a copy of today's show, give us a call at the number on your screen. And don't change that channel because when we return, we're talking more with Dr. O'Reilly about prevention. We'll be right back.